G'day, Stephen Playford is my name. In this section we're going to be talking about pressure reduction and how pressure reduction equals ulcer prevention. For long-term bed patients or people sitting in wheelchairs all day long in long-term care and such, they find that this is all too common a problem because the pressure on the bony prominence compresses the capillaries that would normally allow oxygenated blood to fit into those capillaries and keep them healthy and stop the tissue from breaking down. Australian Medical Sheepskin compared to synthetics shows a major reduction of pressure at the skin interface, which basically disallows or prevents people from developing pressure sores at the outset. You can see that this lady laying on standard Australian Medical Sheepskin bed pad, you can see that the area that she's laying on is helping to reduce the pressure on the bony prominences to stop her from developing wounds, and it does that in a very unique way. And the way that it does that, in this next slide, you can see that there's approximately 75,000 fibres per square inch in this product, which as each follicle individually helps to reduce pressure or act as a shock absorber, it disperses the pressure evenly throughout the human body, which reduces the pressure at the bony prominences and actually allows blood flow to pour into those capillaries, giving the tissue the oxygen and the components that it needs from the blood to stay healthy and to not break down itself. The bony prominences that are most affected in the human body are the heels or the back of the ankles. We also have the coccyx, which is above the buttocks. We also have the elbows, which we lean on the sides of wheelchairs quite regularly. And we also have the shoulder blades or the scapula, which are another bony prominence that is affected. Australian Medical Sheepskin manufactures a range of products that deal with helping to prevent the pressure on these bony prominences, whilst at the same time creating major comfort for the individual laying in bed or sitting in a wheelchair, as we manufacture bed pads, wheelchair accessories and so on as well. In the next few slides that we're going to be looking at, we're going to look at the comparison between the synthetic based products and Australian Medical Sheepskin as a pressure relieving or a pressure reducing device. The difference between synthetics and Australian Medical Sheepskin as well is that synthetics cause body temperature to rise, as they cause perspiration and such, and moisture content at the skin interface, which is something that we'll talk about in further sessions as we go through today's talk. With the reduction of pressure at the bony prominences with these different types of devices, we've had varying rates of success, but none like the rate of success that we have had with Australian Medical Sheepskin. The chair that was used in this pressure mapping was of a tilt and recline design, and that is designed to take excess pressure off the backside when a person is sitting in the chair and reduces that pressure so that they are not so susceptible to breaking down. Firstly, we have a rubber pressure reducing device that has an eggshell component or look-alike to it. It's designed to reduce the pressure, and you can see in this pressure reducing aspect, it got the pressure rating on the skin interface down to 25.23 millimeters of mercury, which is not too bad. But having to deal with the rubber component, still we are then dealing with moisture content at the skin interface due to perspiration build-up through sitting on a rubber surface. The next product that you can see there is a T-foam. It's a foam-based cushion, and it's designed to reduce pressure as well. However, you can see in the 45-degree tilt, 25-degree recline, that the pressure rating on the T-foam got down to 20.13 millimeters of mercury. Still not bad, but when the Australian Medical Sheepskin is placed into the exact same chair in the same tilt and recline position, the pressure rating went down to 11.89 millimeters of mercury, which is a massive reduction in pressure at the skin interface. But not only does the sheepskin have the ability to reduce the pressure at the skin interface, but other aspects as far as moisture absorption, reduction of shearing content with the fibre moving with the skin tissue, and the product's ability to maintain standard body temperature at 37 degrees are areas that we are going to cover in further sessions as we go. So what we've pretty much talked about there is the product's ability to reduce pressure in a long-term or a home care type situation for somebody that is sitting in a wheelchair or laying in bed all day and needs to be met for pressure reduction at the skin interface. Australian Medical Sheepskin meets these demands and has been doing so for the last 18 years in Canada, and we continue to keep striving to manufacture products that will enable better aspects for individuals in these type circumstances in both home care and long-term care. I hope you found this information helpful, and if you need further information, please do not hesitate to contact us at Australian Sheepskin Apparel at shorebiz.ca, or you can find further information on our website on australianmedicalsheepskins.com, and anything that you need from there, please feel free to ask. Thank you for coming.